Hello and welcome to the Fit News Podcast. I'm your host, Jen Shaver, and joining me today is Dr. Marguerite Weston. She is a highly accomplished medical professional with a diverse background. She earned her Bachelor's of Arts in Molecular Biology at Ohio Northern University, followed by medical training at the Medical College of Ohio. Dr. Weston brings a wealth of experience, having served as a primary care and sports medicine physician in various prestigious institutions, including McBride Orthopedic Hospital and University of Oklahoma Goddard Health Center. Her journey also led her to academic faculty roles at the University of Wisconsin. Now in Columbus, Ohio, Dr. Weston continues to make a significant impact as a functional medicine physician. She holds a certification from the Institute of Functional Medicine and more than 17 years of practice with board certifications in both family medicine and sports medicine. As a wellness patient herself, she understands the feeling of frustration and disappointment that arises when you feel like your care provider just isn't listening to you. She has been on the other side of the doctor's office, hearing that things aren't quite normal, but not abnormal enough for diagnosis. That's tough to hear when your daily life becomes difficult because of your health. Dr. Weston uniquely combines a solid foundation of conventional medicine with the best contemporary functional medicine practices for a fresh approach to optimizing your overall lifestyle. Dr. Weston, thank you so much for taking the time to join us today.
Well, thank you so much for having me.
Of course, I'm excited to chat today. We have some interesting stuff that we're going to chat about because we are going to talk about the Dutch test. And to get started with that, I think we should probably start with simple terms for people. And what is a Dutch test and how does it differ from traditional hormone testing methods?
Yes. So traditionally, we test hormones with blood, and that is where a lot of the studies were first done on hormone testing was with blood work. And blood work is very important. I do blood work routinely,
Yeah.
but blood work is just like looking at a bank statement. So we can just see how much you have in the bank at that exact moment in time, as far as estrogen, progesterone, DHEA, testosterone. So all of those things, thyroid, those can all be measured in the blood. The urine is a little bit different in that it measures metabolites. So metabolites are breakdown products of our hormones. And so we like to think of it as looking at our receipts. So we can look at how we spent our hormones. And so it is much more of a comprehensive approach. I think both of them are very important.
Yeah. So the Dutch test is just another tool. And so as you mentioned, so we have blood tests, but the Dutch test involves urine.
Correct. Or saliva
Okay.
or saliva.
Okay.
So what it stands for is dried urine test for comprehensive hormones.
Okay.
And so patients can collect it at home. It is usually a series of several urines over the day or salivas. You can also actually do what's called a cycle map, so a Dutch cycle map. And that is mostly we use for fertility, but sometimes we'll use it if, gosh, if someone is having symptoms through the month and we're having a hard time explaining it through just the Dutch test on one single day of our cycle, we'll want multiple different records through the month. We can use the cycle map. And so what it does is it gives us breakdown products of your testosterone, of your progesterone, of your estrogen. And then it also gives us information on your cortisol.
And we know that particularly during perimenopause and that menopause transition time, that cortisol becomes a key player.
Cortisol,
I mean, it gets a bad rap.
It does get a bad rap, but it's so important. I mean,
Right.
we need cortisol.
Right.
The thing is, I mean, hormones are just communicators.
Yeah.
By definition, they are messengers, and they are used to tell our body what to do, what not to do, what we have enough of, what we need more of. And so by definition, it is very difficult to have an abnormality in one hormone and it not affect downstream hormone players. And so to really just check one or two hormones, it's hard to get a full comprehensive view of what's going on because cortisol affects so many other things.
Right. Right. So the Dutch test then provides valuable insight into hormonal balance and function for individuals, correct?
Yes, correct.
Okay. Especially those that might be dealing with like a specific health concern or condition. Are there, times that it would be more valuable to do this?
Yeah. So I have a few different groups of patients,
Hmm.
right? So I have some patients who they come in, they just want to get a baseline. They
Hmm.
just want to see like what their hormones are doing because they want to know.
Right.
Another group, they might have a family history of breast cancer. And
Hmm.
in that case, I think it's great to have at least a one-time Dutch test to see genetically what your predisposition is as far as metabolism of estrogen, because there are some ways that we can metabolize or break down estrogen that are not as healthy as others, and we can treat those
Hmm.
and push that metabolism into a healthier pathway. Then I have patients who are starting to have symptoms. So I have, and that can be a multitude of different ages. We have
Hmm.
patients in their 20s who are having really heavy periods. They're having, maybe PCOS, maybe endometriosis. Those patients, Dutch test can be very helpful.
Hmm.
Patients in perimenopause, when we don't know, our body is just almost converting back to menarche when we first started having our periods. I always
Right.
feel sorry for those moms who are dealing with perimenopause and they have a teenager going through menarche. Like, I just can't imagine their home.
Two worlds colliding, right?
I know, which will be my world very soon with my daughter.
Yeah.
And so those patients, we can help make that perimenopause transition a little
Hmm.
more graceful. It doesn't
Hmm.
have to be a, grin and bear it kind of season of life.
Right.
And then postmenopausal, when we are doing hormone replacement, if I'm
Hmm.
giving someone hormones, gosh, I want to make sure that they're metabolizing them in a healthy manner.
Right. Right. So are there, so the Dutch test particularly beneficial, like in your practice, and how does it contribute to a more personalized approach to someone's healthcare?
Yes. So a lot of times, the symptoms that we have surrounding our period,
Hmm.
whether it be heavy cycles, cramping, headaches, breast tenderness, mood changes, bloating, those kinds of symptoms are often dependent on the balance between estrogen and progesterone.
Hmm.
So it's not only the absolute number of estrogen and
Hmm.
progesterone that we have, because I can have a ton of estrogen, but if I have enough progesterone to kind of cover that estrogen, because we think of estrogen as the gas pedal and progesterone as the brake.
Okay.
So if I have a ton of estrogen, but I have enough progesterone to cover that, so if
Hmm.
you think of it like a credit card bill, if I charge $10,000 and pay it off with $10,000, I don't feel that imbalance as much
Right.
versus I can charge even just $100 of estrogen, but if I only have $10 to pay it off, I'm going to feel that imbalance, especially
Hmm.
month after month.
Yeah.
And so that balance is really important. And when I find that there is a balance, which I can see on blood testing if we can do it at certain times of the month,
Right.
but what the Dutch test allows me to do is to try to figure out why you have that imbalance. Where is that imbalance coming from? Do you have too strong of estrogen? Because there are three types of estrogen.
Hmm.
Are you not getting rid of that estrogen appropriately or efficiently? Are you going down the wrong pathway that can give you those symptoms? So that's the difference between me looking at two patients and they can have the same amount of estrogen on their blood work.
Hmm.
But their Dutch test can give me a little more insight. And then our treatment plans will be different based on what I see in the Dutch test.
Hmm. And I think that that's what's so important. What you just mentioned was basically finding why is this happening? Not just, okay, I have this answer, right? But how did we get to it? And why do I have this answer? And that's really the key
Mhm.
is understanding that component.
It really is. I mean, and our treatment plan is based on that.
Yeah.
And you know, one of the things that is probably most rewarding, I think, when I get to go over a Dutch test with someone is that women feel validated
Hmm.
because for so many years they've probably been told, well, it's just the way it is. You just have heavy periods, or, well, it's just perimenopause, just grin and bear it and you'll get through it. We've
Hmm.
all been there.
Right.
We all have to go through it. Like it's some sort of rite of passage. And I think when I can show women this is why you might not want to touch your husband with a 10-foot pole. Or this is why you are so uncomfortable that week before.
Mhm.
Or even when dealing with cortisol, like this is why you're so tired. It gives us the freedom to just live in that for a minute.
Mhm.
We
Right.
aren't that person.
Right.
It's not just, pull yourself up by your bootstraps and get through it and just
Yeah.
smile and put on this facade. Like there's a
Mhm.
physiologic reason why these things are happening. And so it gives us a little bit of control in an area that I think we've probably been told for a while that we don't have any control over.
Right. Right. Well, yeah, I mean, especially, like you mentioned, okay, the heavy periods, right? We're often that's just the way it is, right? That's just the way it is. Deal with it.
Or go on
And
birth control.
right, right. Take this pill instead of saying,
Yeah.
well, why do you have these? What is causing
Yeah.
these heavy periods? Because just because something is quote unquote common does not make it normal.
You're so right.
And that's what I think we deal with when it comes to so many female issues is
Mhm.
they're so common, but that doesn't make them quote unquote normal.
Right. And I mean, when people talk about perimenopause, that can be a decade of your life.
Right.
Who wants to be like subpar
Right.
for a decade of their life? That's a long time.
Yeah.
So yeah, it's going over a Dutch is probably one of my most favorite appointments.
Hmm.
Just because I just see women, I don't know, like breathe a sigh of relief, like, oh my gosh, it's not just me. It's not just like my personality, or, gosh, there are other options besides birth control or surgery. And that's not to say that some people don't need those things.
Right.
There, I practiced conventional medicine for
Hmm.
almost 2 decades, and there is a beautiful place for conventional medicine,
Right.
and sometimes that's needed.
Hmm.
But I think there's space for both and a role
Yeah.
for both,
Right. Right. Yeah. You definitely need to marry the two.
for
And
sure.
there's, just like with anything, right? There's balance,
100%.
right? But sometimes what happens is the conventional takes over, right? And it doesn't allow for findings what's actually causing all of these symptoms, right?
Yeah, and I think sometimes patients think they have to choose one or the other,
Right.
and that's not the case. I want to join with someone's primary care doctor,
Hmm.
and work together.
Yeah.
We're all on the same team, just trying to get patients to feel good, to be
Hmm.
healthy.
Right.
And so it really should be a team approach.
Hmm. What are some main things when looking at a Dutch test that you are looking for?
Yeah, so a lot of that depends on symptoms when
Hmm.
patients come in.
Hmm.
So, we have information about androgens. So,
Hmm.
androgens are, quote, the male hormones, but very important for females as well,
Right.
important for bone health and libido and energy. And so, we're able to see how you break those androgens down,
Hmm.
and that's important because sometimes you'll have patients who have side effects, or that have hair where you don't want it. So
Hmm.
hirsutism, it's called. So maybe hair on the chin or on the upper lip, and then hair loss up in the temples a lot of times,
Okay.
acne. So some
Hmm.
of those side effects and symptoms can be because of how we break down those hormones. And
Oh.
so we can adjust treatment if we see that on the Dutch test.
Hmm.
We also see progesterone and how you break that down. So there are two main pathways for how we break down our progesterone. Both are wonderful pathways. One is very important for protection for our breast and endometrium. I said earlier that estrogen is the gas pedal and progesterone is like the brake.
Hmm.
And so if we constantly have our foot on the gas, which means constantly having growth within the lining of our uterus and our breasts, it's not beneficial. It can put you at increased risk for those types of cancers.
Hmm.
And so we need enough progesterone in that pathway to help protect our breast and endometrium. The other pathway for progesterone crosses the blood brain barrier. And that metabolite is important for anxiety, to decrease anxiety, and to help with sleep,
Hmm.
which, as a side note, is a reason why, as we get closer to menopause and
Hmm.
cross that bridge into menopause, sometimes women will complain that they're more anxious, they can't get their mind to settle down, they can't go to sleep. That's
Hmm.
usually why we have those symptoms.
Hmm.
And then with our estrogen, we can see our 3 types of estrogen. So
Mhm.
we have 3 of estrone, estradiol, and estriol. Those are the 3 types. And then we can actually see in a pictorial view how we detoxify or get rid of that estrogen. So
Mhm.
we can see phase 1 of detoxification and phase 2.
Mhm.
And the reason that I think this is important is because it does give us a window into detoxification of other things. Because we
Yeah.
don't just detox estrogen, we detox everything, even just our normal garbage that our cells make from doing what they do every day. We have
Yes.
things we need to detox out.
Mhm.
And so it gives us a window into how well we're doing that as a whole.
Mhm. Okay. And then what about, I know that there's a term that a lot of women have, start to hear during perimenopause and menopause time, estrogen dominance, right? That's kind of like the buzzwords that start flying around. Oh, I heard
Yes.
this. And then, well, what is that? And is the Dutch test something that, shows that?
It does. So estrogen dominance is like that credit card that I was talking about. It's when we
Mhm.
have too much estrogen in comparison to our progesterone. So it could be because we're making too much estrogen. It
Mhm.
could be because we're not getting rid of estrogen efficiently, or and it could be because we have low progesterone that's not covering that estrogen.
Mhm.
So a lot of times when I have patients come in and they say, well, I asked my primary care to check my hormones, but they said that they just cycle too much and they change all the time, so we can't really check them, which is true. They do cycle.
Mhm.
However, we learn in school how they're supposed to work. So, if you're talking about a typical 28-day cycle, which not everyone has 28 days, but if you have
Right.
a regular cycle,
Mhm.
when you ovulate, say around day 14, that's when your estrogen should be its highest.
Mhm.
And then mid luteal, so that's halfway between when you ovulate and when day 1 of your cycle, that's mid luteal time. That is where estrogen will have another little peak. So estrogen will be high, come down a little bit, go up a little bit again, and then come back down.
Mhm.
Progesterone starts low in that first phase, and then that comes up and that peaks at that mid luteal time. So that's the ideal time to check for estrogen dominance, because we
Mhm.
know estrogen really shouldn't be dominant at that time.
Yeah.
And what do you know? That's usually when we have all of our symptoms, right?
Yeah. Yeah. So what are the dangers of estrogen dominance?
Yes. So we have the symptoms that we talked about. So those
Mhm.
are all the things, right? And
Yeah.
and those symptoms can also be from the quick fluctuation from
Mhm.
the high and then the sudden drop of hormones. And so, those are the things like heavy periods, cramping. Um, you can even have mid-cycle spotting,
Mhm.
breast tenderness, the mood issues, headaches, those things. But if we live with that constant estrogen dominance,
Mhm.
that constant gas pedal, constant growth, unchecked growth in our body is not helpful. It can be
Mhm.
dangerous. And
Yeah.
so we know that women in the highest quartile of estrogen have the highest risk for estrogen sensitive type cancers, like endometrial or breast
Mhm.
cancer.
Okay. All right. And so is there a perfect time to do the Dutch test within your cycle, or is it something that can be done at any time throughout, or?
So, if you are cycling regularly, we like to do it mid-luteal. So, if you have a 28-day cycle, it's usually around day 19 to 22 that we try to catch it. And
Mhm.
if you have a longer cycle, we just shift that a little longer. And if you have a
Mhm.
shorter cycle, we shift it a little shorter.
Mhm.
If I have patients who are not cycling, then we can typically do it whenever.
Mhm.
If I have, a lot of patients I have, maybe they've had hysterectomy, but they still have their ovaries,
Mhm.
or they may have had an ablation,
Mhm.
where an ablation gets rid of that lining so you don't have the bleeding, but it doesn't change your hormone
It doesn't
cycles.
solve the problem.
It doesn't solve that estrogen dominance. And so sometimes we try to play with, some of my patients can kind of guess when they're cycling. Sometimes we might try to do some LH strips or something to see. We might do
Yeah.
blood work first to see if we're right and then do a Dutch test. So lots of different things that we can do to try to make sure we catch it at the right time.
Yeah. Is there anything else that you think we missed that women need to know about the Dutch test? Actually, I have a question. Is the Dutch test for men as well?
We can do the Dutch test in men. So Estrogen is very important for men as well.
Hmm.
Um, Within the Dutch test, we can see that our androgen, so those male hormones, you
Hmm.
have testosterone. Testosterone can actually be aromatized into estrogen, and that happens in our periphery, so in our
Hmm.
fat cells around our body. And so estrogen is really important for men as well,
Yeah.
especially if you think about it. If I have a man and he is fatigued, maybe he has issues with erectile dysfunction,
Hmm.
it could be that he's taking his testosterone that he had and he's aromatizing all of it into estrogen.
Hmm.
And so I mean, estrogen's important, but they need testosterone too.
Right.
So it's a balance for them
Yeah.
as well. So yes, we can do the Dutch test for men.
Okay, interesting. And then is there anything else that you think we missed regarding the Dutch test and what people need to know about it?
I think it's important to realize that there are things you can do with your lifestyle,
Hmm.
with what you eat, with exercise, maybe some supplements. Sometimes we use pharmaceuticals. I'm an MD, so we can prescribe them if needed. But there are a lot of things you can do to change how your body disposes of your hormones and your hormone
Hmm.
balance. And you are not tied to your genetics. So genetics are important, yes, but gosh, genes can be turned on and off,
Hmm.
and they can be turned on and off through diet and through
Yeah.
lifestyle. And so I think just that we have more control than what we think we do.
I think that's a very important message that people need to understand that just because we say, let's do the Dutch test and find out all this information, that it doesn't necessarily mean that we're saying, then we're going to put you on these pills. What
Right.
it means is we're going to, now we know what's causing your symptoms. Now we're going to look at how we can modify diet, exercise, the lifestyle, right?
Without a doubt.
Lifestyle changes
Mhm.
that you control. So it's about looking at the things in life that you control as a person
Yes.
within your body.
Yes.
Yeah.
And also, I know we didn't touch on it,
Hmm.
but we do get cortisol information
Yeah.
and something called oats. So we get organic acids in our
Hmm.
urine, which are just breakdown products that we see. So we get some information on B vitamins, information on some gut inflammation, DNA damage,
Hmm.
a couple of neurotransmitters we get information on with the Dutch test. So
Hmm.
it really is just a comprehensive approach to hormones.
Hmm.
Um, and for your viewers, if they're interested in learning about Dutch Test,
Hmm.
DutchTest.com has incredible patient education.
Okay.
So, if you want to learn a little bit more,
Hmm.
they have great education there. And if you are going to find a provider who does it, just make sure they do it regularly. Um,
Hmm.
and but there's so much information you can learn even on your own.
Yeah. Now, speaking of providers, do you work with people outside of Ohio?
I do. We
Hmm.
usually ask that they come in person once a year.
Hmm.
So other than that, though, we can do
Hmm.
telehealth and
Virtual.
we do
Okay.
televisits. Mhm.
Okay. And if people are interested in finding more information on you, where can they find that?
So you can go to, Donaldson Plastic Surgery is where our wellness center is
Hmm.
located. And I'm also on Instagram. If you have, I try to put some helpful education out there as well. Um, but we have a phenomenal team here.
Hmm.
And we just love walking this journey with women.
Hmm.
I think it's fun to uncover things about patients.
Yeah.
And honestly, the more excited the patient is, the more excited we get.
Well, it is such a personalized approach to medicine as opposed to you fit this, box in the textbook. Here you go. Bye.
Yes. Yes, because we're all so different.
Yeah.
I mean,
Yeah.
we are all so different. And yes, conventional medicine is great. The
Hmm.
the cookie cutter is needed in some things.
Right.
But gosh, when you don't fit that box or you
Yeah.
go to the doctor and you're like, I don't feel well, and they say, well, all your labs are normal,
Yeah.
there's nothing to do, that is really disheartening. And that can really honestly affect our personality.
Yeah.
And
Yeah.
so our goal is to give patients a place to come where it's a safe place.
Hmm.
you know, we want to meet them where they are.
Yeah.
I don't think we put out these unobtainable goals for people. We want to be, I always tell people our goals are supposed to be challenging but obtainable,
Right.
because we
Right.
want it to be lifestyle. I mean, you wouldn't have someone
Right.
totally change, revamp everything in their,
Right. Right.
workouts and their life, because that's just not doable
Right.
long
It's
term.
long term. And that's just it. It's like, yeah, anybody can do it for 30 days, right? The whole 30-day
Right.
challenge. Most
Right.
people are like, yeah, I got this. But neither one of us is interested in helping people for just 30 days. We want whatever we do with them to
Yes.
be forever and to make a
Yes.
lasting impact, not just, 30 days, 60 days, whatever. Yeah.
100%.
So, well, Dr. Weston, we appreciate your time today and thank you so much for joining us.
Oh gosh, thank you.
Thank you for listening to the Fit News podcast, and we will catch you next time.